Hey there, it's Dr. Michelle Sands, and I want to give you a brief little lesson about micronutrient testing, why it's important, who it's for, and why we use it so much in our practice. We're going to get into micronutrient testing in this fairly short lesson on what it is, why it's important, and what it helps us with. So let's dive right in. So, why is micronutrient testing important and what really is it? Well, the micronutrient testing that we use in Glow Natural Medicine is really the top of the line testing. It provides the most comprehensive nutritional analysis available by measuring the functional deficiencies at the cellular level. So this is really important. So it's not just measuring the serum, the blood numbers, it's really measuring functional deficiencies at the cellular level. It really assesses how well your body uses over 33 vitamins, minerals, amino acids, fatty acids, antioxidants, and metabolites. And at the same time, it's really looking to understand the body's need for these micronutrients because it's looking to see how well you're producing enzymes and hormones and other substances essential for proper growth, development, and overall good health. The test that we use provides really the basis for creating a personalized functional approach to addressing a wide variety of clinical conditions, including arthritis, cancer, cardiovascular disease, high blood pressure, diabetes, osteoporosis, immune disorders, metabolic disorders, and micronutrient deficiencies. So it really is a broad spectrum testing, and it really gets the information from a functional cellular level. Okay, so a lot of times we think about, well, my nutrition is really good. I'm eating a lot of good food. I'm really good about taking my vitamins. Can I still be nutrient deficient? And so while clinical syndromes of vitamin nutrient deficiencies are unusual in modern cultures, suboptimal vitamin status is very, very common because suboptimal vitamin status is associated with many chronic diseases, including cardiovascular disease, cancer, and osteoporosis. It's important for us to really identify what's going on with our need for increased vitamins. Now, many of you know that our soil has become depleted. Our vegetables and our fruits are sprayed with pesticides and herbicides, and that is decreasing our ability to absorb these nutrients. And then also, different environmental exposures, stress, all these things can lead to micronutrient deficiencies. So even if you go to the doctor and they're testing, let's say, your blood calcium level or your iron level in your blood, they may come up with a number that isn't a functional number. So you may walk away thinking that you have plenty of calcium, but the true fact of the matter could be that your blood calcium is normal levels because you're actually leaching it out of your bones. And so you might be suffering from osteoporosis and wondering why your calcium levels are good. It's because your body is actually stealing calcium from your bones. So in the testing that we do, we're really looking at the functional status, which is a little bit different. So you might be like, look at this picture and laugh. You have two women here. They're both considered normal, healthy individuals by conventional medicine. But you can see that their energy levels and their excitement about life and how they look and feel is way, way different. And this is because the woman on the right-hand side who's doing her workout in the sun, she's lean, she's sexy, she is at the optimal level for her micronutrients, while the poor lady who is drinking her coffee and falling asleep on her laptop, she is suffering from suboptimal nutritional status. And both the regular doctors, unfortunately, in conventional medicine, they don't do these types of tests. And so they're both considered just as healthy as one another. But we know that you want more. And so here's a slide that kind of shows you all the different effects, downward spiral effects of having a micronutrient deficiency. This is everything from adrenal fatigue to hypertension to depression, thyroid issues, GI issues, fibromyalgia, fertility, anxiety, weight management, diabetes, headaches, everything. Most of the things that I see on the intake forms that I go through every day, most of the complaints of women over the age of 35, of moms that I work with who really want to perform well and really want to basically have it all, do it all, and enjoy their life, a lot of these things hold them back. And so while it's important to really, look into thyroid health and to examine the thyroid organ and to look at, the adrenals and look at those things, it's really important to first look at micronutrient deficiencies. And before that, look at GI health to see how you're absorbing and assimilating your nutrients. But then you can still have a deficiency. It could be through stress. It could be through a genetic predisposition. It could be an environmental factor. And so really digging deep into where these deficiencies lie and if they are in fact there will help us to really reverse a lot of these conditions a lot easier than if we didn't have this information. So why should you test intracellular micronutrient status? If you have any of these issues, low energy, allergies, migraines, fibromyalgia, depression, chronic fatigue, PMS, weight concerns, menopause, and all of these things in this first column, these are things that are considered normal signs of aging by conventional medicine, but I know that those are suboptimal symptoms. So those are not symptoms that someone who is living an optimal wellness lifestyle, who is leveraging their genetics for optimal wellness, those are not symptoms that they have, but it's many things that we just kind of deal with. And so if you have those, or you have anything in the next column, or you want to prevent it, things like Alzheimer's, arthritis, cancer, heart disease, stroke, dementia, high blood pressure, diabetes, osteoporosis or osteopenia, infections, if you have any of those or you want to prevent them, or if you want more energy, you want to be more resistant to infections, you want to get sick less often, you want stronger bones, more balanced moods, a healthy sex drive, weight control, mental focus and acuity, healthy skin, less wrinkles, and vitality as you age, then you'll want to really ensure that you have optimal micronutrient status. Okay, so this slide here, I'm going to give you guys a copy of this as well in a PDF that you can download. But this kind of goes over just some of the general nutrient deficiencies and functions. These are some of the most common. I'm not going to go through the whole slide, but it really talks about very, very common are folate deficiencies, vitamin A deficiencies, vitamin B12, B6, B3. A lot of the B vitamins are common, and it kind of tells you what they do in the body. For instance, vitamin B12, this is for healthy nerve cells, this is for healthy genes, red blood cell production, iron function. Where you get it is from fish, meat, poultry, eggs, and dairy products. So a lot of the vegetarians are going to be very deficient in B12. And what happens if you're deficient, you can have weakness, constipation, weight loss or weight gain, tingling in your hands and feet, depression, dementia, poor memory, anemia, fatigue. So all these things are not favorable symptoms. And so that's just one of the examples. And I'll give you this to look at in your own time. The next slide we're going to look at it's kind of interesting because this shows you all of the drugs, or the most commonly used drugs that cause nutrient deficiencies, and what the potential health problems that arise from these nutrient deficiencies that are induced by prescription drugs. And as more and more people are taking more and more medications, both over the counter and prescribed, so this is not just for prescribed controlled substances, this is also for over the counter medications like Pepcid and Tagamet and things that you can get at the drugstore. Antacids, Tums even is in that top section. So as more and more people are taking these things for their symptoms, nutrient depletion is escalating, and these nutrient deficiencies are what cause many of the side effects of these medications. But also many times these symptoms, these health problems that are the result of these nutrient deficiencies don't appear for several years down the line, and they're thought of as unrelated to the drug. And so you may have taken several courses of antibiotics growing up, and now you might have issues with your GI tract, or you might have osteoporosis or heart issues or blood pressure issues. And that's directly related to the antibiotics that you may have took 10 years ago. And so I'm going to give you guys a handout of this as well. It's really, really interesting, especially if you are on any medications that you take often. This is including like female hormones, birth control pills, antibiotics, cholesterol drugs, antidepressants, antacids. And so these are the most commonly prescribed medications. And there's a whole host, as you can see, there's a big list here of symptoms that happen based on the nutrient deficiencies. So if you are taking a prescription medication, I highly, highly recommend getting micronutrient testing done so that you can avoid possible detrimental effects, which can be irreversible, things like hair loss, things like cardiac damage. This can be something that is going to hurt you long term and can set you up for a more difficult old age and increased accelerated aging. And so this is definitely something that we want to look into. Okay, so the next slide here, this is like why we might want to look into micronutrient testing and how we use it. And so, there's a few different categories. So we can use it for disease therapy and disease management. So this is people who have a chronic or degenerative disease. We can use the information from micronutrient tests to really look at how we can use targeted supplementation and diet to manage and to reverse a lot of the risk factors associated with the disease. So this is prevention and for the management and treatment of chronic degenerative diseases. Also, anyone with a family history, anyone who has a family history of common diseases, whether it be cancer or diabetes or heart disease, it's really good to look to see if there is a genetic disposition for this nutrient imbalance and really work to replete and manage that through understanding what your body is doing with the nutrients and which ones it's in need of. Also high risk groups. So there's certain groups of people who are more susceptible to vitamin, mineral, and antioxidant deficiencies, and that can really affect their overall health and treatment outcomes when we're doing other types of treatments, other protocols. Certain people who are more susceptible to having these deficiencies are going to do not as well if they don't take care of the deficiencies. Also, we use this most commonly for proactive risk assessment. So this is just prevention and early detection. Like many times you might not have, a lot of people I work with, they're not sick. They just want to have more energy. They want to reverse the aging process. They want to be, healthier, happy, sexy, have great sex drive for many, many years to come. So they're actually working with me proactively to prevent any disease, any negative symptoms. And we can use this test to really, as an early detection of any nutrient deficiencies that might lead to health issues down the line. And then also finally, we use this type of testing for challenging cases. So we can really gain insight into why symptoms are happening when there's no apparent specific disease that the person has. So someone who is generally healthy, they don't have a parasite, they don't have a thyroid condition, their hormones appear to be balanced, they don't have liver problems or heart problems or cholesterol problems, yet they're still feeling not great, not optimal. This testing can often help us identify the causes of these symptoms when there's no specific disease associated with them. And so in all these cases, we're looking to identify deficiencies through micronutrient testing, and then we're going to be able to create a comprehensive, personalized, and targeted plan through supplementation, diet, lifestyle, all of these things that we do in the GLOW protocol, all the foundations of health. We can target them a little more and personalize them a little more for specific therapies. And then we're going to monitor, and we are going to retest, and we're going to reassess, and we're going to revise protocols and plans based on the information we get. Retesting generally 4 to 6 months after working with the results and creating personalized plans. We can see some great changes and some great improvements, but sometimes there's some sluggish improvements, or there's a counteraction, something going on that we need to address and change, course correct, basically. And so we like to continue to monitor that. Okay. So then this next slide, you're going to see these are all the vitamins, minerals, antioxidants, amino acids, fatty acids, carbohydrate metabolism markers, and antioxidants and immune response score. This is all the things that we measure on this one test that we like to do in our practice. This is the most comprehensive, the most state-of-the-art, and the most accurate test available. Generally, it's not run by conventional medicine doctors. It's typically only run by functional medicine doctors, and even those doctors a lot of times don't run this test. Either they don't know about it, they don't understand it, or they don't have the tools to actually do anything about it. And so that is one of the reasons why you might not see this test everywhere, but it is a great test, especially when you're working with a practitioner who knows how to use the results to help you. So it's really extensive. And then the nice thing about the test, this is just a little snippet of how your results are reported. So it's really visual and easy to read. You don't need any special training basically to understand your test results. You'll see on the left-hand column, it's measuring vitamin B12, and there's a little green dot above in the white section above the blue line, and that is showing on the key on the side here. That's adequate, so you're doing well. Now, the next marker is vitamin D. You'll see this is in the red, it's in the blue area, so this is deficient marker. And then on the third one, this is the spectrox, so this is the immune and antioxidant marker, and that is in the good level. Now, if the marker was right on this line between the white and the blue, then that sometimes can be a borderline deficiency, and sometimes they'll report that to you as well. And so it's good to see that as well. And then finally, the last slide, this is just talking about the Immunodex response. So the test also covers not only vitamin nutrients, but also chronic stress, which is great. The Immunodex score is basically one measurement to evaluate your cell-mediated immune system performance. So specifically, it measures your T-cell lymphocyte proliferation. So you may remember from previous modules that the immune system is comprised of two sides. So you have the Th1, which is cell mediated, and then you have the Th2, which is humoral. And when they're balanced and performing optimally, that provides us with the protection that we need and promotes health and wellness. And so micronutrient deficiencies often undermine a person's immune function. So the lower the Immunodex score, the less active the immune system is, and the more reduced immune response you'll have. So you basically want a higher Immunodex score, and by correcting specific micronutrient deficiencies, we can raise this Immunodex score, and that contributes to tangible benefits, including reduced infections and assisting in that balance between the Th1 and Th2. So this can really help with autoimmune conditions. This can help with GI infections. This can help with a lot of the things that we deal with on a daily basis in our practice, but also things like cold and flu. So they do measure your immune response score against your age, and they want you to have a relative high Immunodex score. So it's pretty much the whole lesson here. Now, if you haven't already done your micronutrient testing, you'll definitely want to go ahead and order that. You want to test, you don't want to guess. So you don't want to be taking a bunch of supplements, whether they've been recommended to you by another practitioner, myself, or if you saw on a magazine or saw on TV that a certain supplement is good for a certain thing. It's really important to know what your body is using and what your body needs. Now, the one important thing to note is that this type of micronutrient testing is generally not covered by insurance, and that's because it doesn't diagnose disease. It more gives us an insight as to how to optimize your health. And it really is one of the best investments you can make in your health, either to improve your current conditions or to prevent future ones. And like I mentioned before, we recommend retesting approximately 4 to 6 months after you began some lifestyle, nutrition, and supplemental changes to improve your micronutrient status. Now, if you came up perfect your first time where you didn't have any deficiencies, then you wouldn't really need to retest, but we recommend retesting 6 months after finding a deficiency. Now, to order your intracellular micronutrient testing, you can fill out the order form below. We will get everything out to you. The pricing is below as well. And then if you have any questions, you can feel free to reach out to me at support@Glow Natural Medicine. Now, if you already have this testing done because it was part of the initial package when you started, then you don't have to worry about redoing it, but you will want to reorder when your 6 months is up. Now, pretty much everyone coming into the program from this point on will be doing the micronutrient testing as part of their initial testing package, but there's some people who either had it done by a different company or chose not to do it in the beginning. But at this point in the program, this is when I really recommend to make sure that you have an up-to-date micronutrient test. So if you have any questions, again, please shoot me an email at support@Glow Natural Medicine. Have a great day. Bye-bye.